So dear students, so today our topic is regulation of respirations. So first we know regarding the regulations of or control of respirations point wise. So that is the first one. That is medullary rhythmic city area. So this area, it was mainly present in the medulla oblongata. So it was involved in the to correct the between the inspiration and expirations. Okay, medullary rhythmicity area, nothing but respiratory centers. So those are present in the medulla oblongata. So those are involved in the regulations of both inspiration as well as the expirations. So next one, so regarding the pneumotoxic area. So this area is present in the pons. So it is decrease the rate of respirations according to the conditions. Next one, that was the apnostic area. It can increase the depth of respirations, so that was helpful for complete filling of the lungs. If the lungs are completely filled by the respiratory gases, means then only the proper exchange can be taken place. And this apnostic area is also present in the pons along with the pneumotoxic area. So and the area is nothing but the group of the nuclei or group of the neurons. So they have become one area. So they having the regulate the particular type of the functions. So here in the pons pneumotoxic area, it can decrease the rate of respiration. Okay, then second one is the apnostic area, it increase the depth of respiration. So that was helpful for to complete oxygenation process it can allow, because the rate of respiration increases means then also the complete oxygenation process do not occurs in the alveoli. Okay, so that was on such conditions in the hyperventilations, on such conditions. So these pones it detect that once it was involved in the with the decrease the rate of respiration as well as increase the depth of respiration through a pneumotoxic area and as well as the apnostic area. So next one is the cortical influences, cerebral cortex. So with the help of the stimuli from cerebral cortex, it is also influence on the inspirations, because cerebral cortex it was involved in the integrations of the message that can came from the organ or different parts of the brain. Okay, then it is involved in the to integration means nothing but to find the solution whatever the problems or changes or arises in the different parts of the body. So that issues in the help of the sensory neuron and integrate that, and it can send to the different parts of brain and as well as to the towards the organ. So on that time the brain itself it can require the oxygen, and as well as that organ was required the oxygen. So that's why according to its activity the cerebral cortex it is also influence or it can regulate the inspiration according to what they are doing, what they insist to the organs. So that's why the cerebral cortex is also involved in the regulation or control of the respiration. So next one is the chemoreceptors. So chemoreceptor function is mainly they can detect the chemical compositions of the blood. So they are present in the that is internal external carotid artery as well as in the medulla oblongata. So their major function is to detect the chemical compositions of blood like hormones, hydrogen ion, carbon dioxide concentration, oxygen concentration. According to that, it can send stimuli or information to the brain. According to that, the brain can regulate the organ function as well as the respirations according to compositions of the blood. So that's why chemoreceptors are also involved in the regulation or control of the respiration. So next one is the proprioceptors. So proprioceptors, so they are mainly present in the leg. So their major function is, so they are note down the changes of the legs. Okay, what are the movements? Simply, it can note down the movements of leg and it can send information to the cardiovascular center or brain. Because so when we are under the rest, leg are also under rest. So on that time we do not require that much blood circulation to the leg. Okay, but when you are walking, slight cardiac output is required. But when we are running somewhere, so on that time, instead of body organ, leg required the more oxygenated blood. Okay, so according to situations of the leg, our cardiac output can be adjusted towards the leg or towards the body organs. So how? So with the help of the proprioceptors are the like chemoreceptors. So these are also sensory receptors. Okay, so they can detect the changes or movement of the leg and send information to the cardiovascular center. According to that, our cardiac output is increases or decreases. Then that was helpful for to fulfill the demand of the leg, or it can fulfill the a complete supply of nutrition to the leg, that was helpful for according to the movements. So that's why the proprioceptors are also play an important role in the control of respirations. So next one is the limbic systems. Okay, limbic systems mainly concentrate, it was present in the temporal lobes, okay, in other part of brain. So then it was mainly involved in the regulations of anticipations, anxiety, and emotions. Its major function, it can regulate anticipations, anxiety, that is a fear. Anxiety means fear and emotions. Okay, for example, in the case of anxiety, fear, automatically our heart rate is increases. Due to fear, the brain required more and more oxygen to stabilize the brain or stabilize the part of brain or organ. So on that time it required more oxygen. So due to that only the limbic system during the anxiety, it can regulate the respiration, can enhance the rate of the respiration. So that's why the limbic systems along with the regulations of anticipations, anxiety, emotions, it can adjust the rate of respirations as well as cardiovascular functions. According to that only our cardiovascular functions can be increases or decreases. During the anxiety, they are increases. During the emotions, they are increases. During the anticipation, then also they are increases. Then only we can give the good anticipations to the our neighbor, family members, friends, वगैरह वगैरह. So like that. So that was the when we our brain having the good oxygen supply. If it is not having the good oxygen supply, we can neglect our relations, our relatives, our friend circles, or the parents. So like that, the limbic system, it was helpful for to control the respiration also. So next one, that was the temperature. So the body temperature is also influence on the rate of respirations. Okay, as the temperature decreases, then the rate of respiration is decreases or increases, or as the temperature increases, the mainly the but that is the rate of respiration is also increases because it is helpful for exhalations of the excess of the heat from the respirations. So that's why as the body temperature increases, the rate of respiration increases. As the body temperature decreases, the rate of respiration is also decreases. So that's why the body temperature is also influence on the respiration or involved in the control of the respiration. So next one is the, so regarding the pain. Okay, so when our body having the pain, automatically the rate of respiration increases, or any part of the organ, if it is having the pain means the automatically the rate of respiration was increases. So that's why the conditions or physiological conditions of the organs or our body, that was also reflects on the rate of respiration. So last one, that was involved in the regulations of respirations, that is the irritations of airways. There is a trachea, bronchi. So if any irritations is there due to entry of the any non-toxic substance, irritant, or dust material, automatically the rate of respiration is increases. This is the one of the defense mechanism to helpful for to expel of the unwanted substance from the respiratory tract. So that's why, so when we are having the allergy, automatically the coughing, sneezing will be the more, because of that was those allergies occur due to entry of allergen or dust particles in the respiratory tract. So there is a need to remove those one. So due to that, automatically the cough reflexes is occurs. Then the rate of respiration is also increases to remove the or kick out the, so those non-toxic substance harmful to the lungs. So that's why the irritations of airways, that is increases the rate of respiration or respiration. So now we learn one by one. So first we can concentrate regarding the medullary rhythmic area. So this, dear students, so this area is mainly present in the medulla oblongata. So medulla oblongata It is having the group of particular neurons. So their nuclei present in there or nucleus present in there. So they are involved in the regulations of only respirations. And those areas or that area was known as the medullary rhythmicity area. So this medullary rhythmicity area, it mainly regulate the inspiration as well as the expirations through stimulating the inspiratory area or expiratory area. Okay, so in the normal conditions, so this area, it acts as a switch. Okay, already you know the use of the switch in our home. It is helpful for to start the fan or to close the fans, or to start the instrument or to close the instrument, or start the bulb or close the bulb. Okay, so like that. So this medullary rhythmicity area, it acts as the switch between inspiratory area and expiratory area. Okay, continuously it can switch on the inspiratory area for 2 seconds. In the normal conditions, the medullary rhythmicity area, it can switch on the inspiratory area for 2 seconds. So due to switch on or stimulations of inspiratory area, the inspiration is occurs. Okay, the inspiration is occurs. And regarding the expiration, so this after the inspiration, same medullary rhythmicity area, it can switch on the expiratory area for 3 seconds, and during that 3 second the expiration is occur. So like that, the medullary rhythmicity area, it was involved in the to control of the inspiration as well as expiration by switching the by or stimulating the inspiratory area for 2 seconds, after that stimulating the expiratory area for 3 seconds. So like that, the medulla oblongata or medullary rhythmicity area, so those are involved in the regulations of the inspiration as well as the expirations. So this is the first components or part of the body that was involved in the to control or regulations of the respiration. So now we can go for next one, that is the pneumotoxic area and apnostic area. So dear students, both these area, so they are present in the pons. So that's why the pons is also involved in the regulations of the respirations. Instead of regulation, so the pons, they are mainly correct the rhythmicity of the respirations. Mainly, so they are correct the rhythmicity of, that is the respiration. So with the help of the certain group of neurons, those are known as the pneumotoxic area as well as the apnostic area. Okay, so pneumotoxic area, so that can send information to the inhibitory impulses. Okay, that was send inhibitory impulses to the inspiratory area, then the inspiratory area can be stopped, then the rate of respirations can be decreases. So when the rate of respiration is abnormally increases, okay, that was create the problem in the exchange of the oxygens or filling of the lungs with the respiratory gas due to abnormal increase in the inspiration. So on that time, so this pneumotoxic area send inhibitory impulses to the inspiratory area, then inspiratory area stop to control the respiration. So due to that inhibitions of inspiratory area, the rate of respiration is decreases. As the rate of respiration decreases, that was helpful for complete filling of the lungs. In other group of neurons, those are known as the apnostic area. So these are also present in the bones. So they are send stimulatory impulses to the inspiratory area. So when this area is activated, so on that time the depth of respiration is increases. Okay, so when this area is activated means, so on that time the depth of respiration increases. This was helpful for complete filling of the lung. So like that, the pons, it was involved in the to control the to adjust the rhythmicity of the respiration, so with the help of the pneumotoxic area as well as the apnostic area. So those are present in the pons. So like that, the pons is also involved in the regulations of the respirations. So next one, that is the chemoreceptors, regulations of the regulation the expression by chemoreceptors. So these chemoreceptors are mainly present in the medulla oblongata or aortic bodies and carotid bodies. So these chemoreceptor, so they are discharge the impulses. So when the blood passes through the medulla oblongata or aortic bodies and as well as the carotid bodies, so these chemoreceptor, so they can discharge the impulses when the carbon dioxide level is increases or hydrogen ion concentration is increases or decrease the oxygen level. And chemoreceptor major function is they can check the chemical compositions of the blood. Okay, so during the accumulations of carbon dioxide in the blood, so the chemoreceptor detected that one. So when the blood is passes through the medulla oblongata or aortic bodies and carotid bodies, so then so they are discharge the impulses, and these impulses can stimulate the cerebral cortex as well as limbic system and hypothalamus. And further, so these part of the brain they can send the stimulatory information to the medulla oblongata or respiratory center. Then the respiratory center, it can stimulate the inspiratory area, so then the inspiration is occur. So like that, the excess of carbon dioxide can be expelled by inspiring the oxygen. Then oxygen level can be corrected by suggesting the inspiratory area by enhancing the inspiration. So that was helpful for exchange of the oxygen. So that of the carbon dioxide, then the blood will be containing the oxygen instead of the lot of carbon dioxide. So that's why the chemoreceptors is also play an important role in the regulations of the respiration. And also, so when the carbon dioxide is decreases and oxygen saturation is increases, so on that time the chemoreceptor, it can stop the discharge of the impulses. And lack of impulses from the chemoreceptor to cerebral cortex, limbic system, hypothalamus, so these are also stop the sending of stimulatory impulses to the respiratory center. And lack of stimulatory responses from cerebral cortex, limbic system, hypothalamus, so this respiratory center, it can inhibit the inspiratory area and enhance the expiratory area. So due to that, the expressions can be occurs. Okay. So next one is the cortical reflexes. So when the blood is passes through the cerebral cortex, when it is having the lack of oxygen means, then this cortical or cerebral cortex send information to limbic system, hypothalamus, then to the respiratory center, then to the inspiratory area, then the inspiration is increases. So like that, the cerebral reflexes is also helpful for the regulations of the inspiration or respirations. Then as well as, so during the that is the anticipations or anxiety emotions, so that was regulated by the limbic system. So when the persons involved in the anticipation or to showing the anticipations are suffering from the anxiety or emotionally suffering from behavior, so on that time limbic system is detected and it can correct the oxygen level in the body, okay, through sending stimulatory information to the respiratory center. Then the respiratory center sends the stimulatory information to the inspiratory area, then inspiratory increase the inspiration. So like that, the oxygen level can be corrected during the anticipation, anxiety, emotions by a limbic systems. As well as the temperature. So as the temperature increases, so that temperature was detected by the hypothalamus. So according to that, the hypothalamus was involved in the regulations of the body temperature by increasing the respiration or decreasing the respiration. So as the temperature decreases, it can inhibit the respiration and automatically it helpful for restore the heat in the body. So as the heat is increasing in the body, temperature increases, it can insist to the respiratory center to enhance the respirations or to increase the rate of respiration. Then that was helpful for to expel the excess of the heat from the body. So like that, the chemoreceptor, cortical reflexes, and that is the limbic system and temperature. So they are involved in the regulations of the rate of respirations or control the rate of respirations. So now we can go for the respiratory volumes, then capacity, respiratory capacities, and as well as the some important respiratory disorders. So first we can go for the respiratory volumes, that is also known as the lung volume. So these are mainly four types, that is the tidal volume, inspiratory reserve volume, expiratory reserve volume, as well as the residual volume. So that is the capacity of the lung, how much lungs can be filled with the respiratory gases or air. So that those are terminology are known as the lung volume. So they are mainly four types, that is the tidal volume, inspiratory reserve volume, expiratory reserve volume, and as well as the residual volume. The first one, that is the tidal volume, it is denoted as a TVE, that is its normal value is 500 ml. And tidal volume means the volume of air move in and move out of the lungs during each normal respiratory cycles. Okay, during the normal respiration, that is the normal inspiration expression, how much volume of air enter into the lungs and as well as exist from the lungs, that was known as a tidal volume. It is denoted as TV, and the capacity of no, that is the adult or normal human being is a 500 ml. So during the normal inspiration expressions, we are inspired the 500 ml of respiratory gases, and as well as normal respiration, either expiration or exhalation, we are expelled out about 500 ml of the air. So that was known as the tidal volume or TV. So that is the entry of air and exist of air, that is how much volume can enter, how much volume can be exist. So that was known as the tidal volume. So next one, that is the inspiratory reserve volume, it is denoted as IRV. The normal value is 3300 ml. So it is the amount of air inhaled above tidal volume, okay, during a forceful breath in. Simply, after normal inspiration, forcefully we can inhale or inspire the some amount of air. So that was known as the inspiratory reserve volume. That capacity is 3300 ml of respiratory gases. We are inspired forcefully after 500 ml after tidal volume. So that volume was known as the inspiratory reserve volume. It is denoted as the IRV. Then the normal range is 3300 ml. So next one is the expiratory reserve volume, that is the ERV. It is normal range is 1000 ml. That is the amount of air extra. Okay, that is the amount of air extra air about normal volume exhaled, okay, during a forceful breath out. Okay, so that is the after normal in expiration. So during a normal expiration we can expel the 500 ml, and after that forcefully expired some volume of air. Okay, forcefully expired some volume of air. So that volume of air is known as the expiratory reserve volume or ERV. That was 1000 ml. So after quite expirations or breathing out, so whatever forcefully we can breath out the some air, volume of air. So that volume of air was known as a expiratory reserve volume or ERV. That was the 1000 ml. So next one is the residual volume, that is it is denoted as RVE. That capacity is 1200 ml. Nothing but after inspiration expression, how much volume of air is present in the lungs, that was the residual volume or that was the RV. That is the volume of air remaining in the lungs. So after maximum forceful expiration, so after expiratory reserve volume, how much air that was left in the lungs, so that was known as the residual volume or RV volume. So that is the 1200 ml of the respiratory gases that was left in our lungs after a forceful expiration. So that volume was known as the residual volume. So these are the normal range, and lung volumes, it was helpful for to know the conditions and status of the lungs. So now we can go for the lung capacities. So once again, the lung capacities are four in number, that is the inspiratory capacity, then expiratory capacity, functional residual and capacity, then as well as total lung capacity. So now we learn one by one. First one is the inspiratory capacity, that is denoted as the IC. It was calculated, that is the sum of tidal volume plus, that is the inspiratory reserve volume, that was totally 3800 ml. That is the maximum volume of air that can be inspired after reaching the end of normal quiet respirations. So how much air we can be inspired after normal quiet respirations? So that was known as the inspiratory capacity. It was denoted by IC, and it was calculated just the summations of the tidal volume and as well as the inspiratory reserve volume. The total normal range is, that is a 3800. That is because the tidal volume is 500 and the inspiratory reserve volume is a 3300 ml and total is a 3800 ml. Okay, so that is the inspiratory volume, that is the 500, that is tidal volume, that is 500 ml plus inspiratory reserve volume, that is 3300 ml, then total is a that is a 3800 ml. This is a our capacity of the lungs after inspiration. We are forcefully including normal inspiration as well as forceful inspiration. We can inspire the air about 3800 ml of the respiratory gases. That was known as the inspiratory capacity. So next one is the lung capacity like a vital capacity. It is denoted as VC. It is calculated by summations of tidal volume and summation of, that is inspiratory reserve volume as well as summations of the expiratory reserve volume, and total is a 4800 ml. That is the maximum volume of air expelled from the lungs after maximum inhalations. After maximum inhalations, the how much amount of the air so that can expelled or exhalations toward the environment, that was known as the vital capacity. And our vital capacity of our lung is a 4800 ml of respiratory gas. We can be expired normal expression as well as a forceful expression. So that amount of air or that lung capacity was known as a vital capacity. It is denoted as a VC. That is the vital capacity. The vital capacity is calculated by tidal volume, that is a 500 ml plus inspiratory reserve volume 3300 ml plus expiratory reserve volume, that is the 1000 ml, and total is a 4800 ml. That was known as the vital capacity, nothing but maximum volume of air expelled from the lungs after a maximum inhalation. So that was known as the vital capacity. So next one is the third lung capacity is a functional residual capacity. It was denoted as FRC and it is calculated by, that is the expiratory reserve volume plus residual volume, and the normal value is a 2200 ml. That is the volume of air remaining in the lungs after normal and passive exhalations. Okay, that is the volume of air. So that was remaining in the lungs after a normal as well as passive exhalation. So that was known as the functional residual capacity of the lungs, or FRC. So that was 2200 ml. It is calculated by, that is the expiratory reserve volume, that is 1000 plus, that is the residual volume 1200 ml, and total is equal to 2200 ml is a functional residual capacity of our lung. It was denoted as the FRC. So last one, that is the lung capacity, is a total lung capacity. It was denoted as TLC. Okay, it is the calculation or summation of tidal volume, inspiratory reserve volume, expiratory reserve volume, and as well as the residual volume. And normal range is a 6000 ml. So that is the definition, is the volume of air in the lungs upon the maximum effort of inspiration. Okay, maximum we can inspire the some amount of air, that was known as the total lung capacity, that was TLC. Then forcefully we can inspire maximum of our air in the lungs is, that is a 6000 ml, about 6 liter. Okay, so it is calculated by tidal volume, that is the 500 ml, plus inspiratory reserve volume 3300 ml, plus expiratory reserve volume, that is a 1000 ml, plus residual volume, that is 1200 ml, and total is a 6000 ml. That was the total lung capacity, or TLC. So this much of air we are, or our lungs can be filled with this much of the air, that is the 6000 ml or 6. So these are the lung volume and lung capacity, and these are helpful for to note down the lung normal lung functions, or it is helpful for to differentiate the normal as well as pathological conditions of the lungs. So where with these lung volume and lung capacity as are helpful. So now we can go for the respiratory disorders. Only for definitions in your syllabus they are mentioning only definition. First is the hypoxia. Hypoxia means deficiency of oxygen. That is the, it is a condition, it denotes the absence of enough oxygen in the tissues to sustain body functions. Okay, that is the deficiency of the oxygen in the tissue level is known as a hypoxia. So regarding the symptoms, that is a fatigue, headache, confusion, tingling extremities, cyanosis, that is the change of the skin color, bluish color, especially in the palm. You look your palm now, currently it is look like a red in color. Okay, when you are having a hypoxia, a deficiency of oxygen, so then our hand becomes the bluish in color. That condition was known as the cyanosis, as well as the person was suffering from the pulmonary hypertension, hallucinations, and as well as nausea. So these are the sign and symptoms of the hypoxia. Next one is the asphyxia. That is, it is a condition of deficiency of supply of oxygen to the body that arise from the abnormal breathing. So due to abnormal breathing, any congestion in the respiratory tract, trachea, or in the lungs, so where the lungs are failed to supply the oxygen or to fail to fulfill the demand of the organs regarding the oxygen, so that condition was known as the asphyxia. And main symptoms of asphyxia is a headache and as well as the cyanosis. It can causes the headache. Then after that, it can see in the, you can see in your regular your palm of your hand. So that we are red in color. If they are changes the color means, so that they denote that we are suffering from the some problem in the lungs or asphyxia or cyanosis. So next one is the dysbarism, that is a blood in the nose. Okay, so change in the atmospheric pressure. Okay, change in the atmospheric pressure that was also reflect on our lung. Okay, so due to drop of atmospheric pressure or pressure surrounding us, so on that time it can causes the blood in the nose. And here the dysbarism, it is a medical conditions resulting from the changes in the ambient pressure. Okay, change in the ambient pressure in the our surrounding area. So due to that, the nose bleeding can be occurs. For example, so when you are driving in the sea, in the more down, just below the 3000 feet, so where, so this condition is occurs because that environment below the sea, it was having the change in the atmosphere pressure, or the pressure of the atmosphere that can be drop as compared to the normal atmospheric pressure. So normal atmospheric pressure is, say, that is a 760. Okay, if it is changes more than that, then we are suffering from the bleeding in the nose. So that condition was known as the dysbarisms. Okay, as well as, so when you are going to the high altitudes, okay, so in the hill station, then also, so this condition is occurs, the blood in the nose occurs, that denote that the environmental pressures can be dropped. So due to that, it cannot be adjusted by our lungs, then the nose bleeding is occurs. So nose bleeding is denotes the, there is a drop in the atmospheric pressure. So next one is the oxygen therapy, that is the use of oxygen as a medical treatment. So that was known as the oxygen therapy. So now you are already familiar with the oxygen therapy. So for treatment of the COVID-19, so they will be giving the artificial oxygen with the help of the oxygen cylinder. So that was known as the oxygen therapy. Here the oxygen used as the medicals. Okay, so medical treatment. So that condition, that therapy was known as the oxygen therapy. So next one is the resuscitations, that is the adjustment of the respiration by artificially. Okay, to correct the rate of respirations in the patient by artificially, that was known as the resuscitations. That is simply mouth to mouth. So anyone having the problem in the respiration, some people they are giving the respiration through their mouth to the patient. So that is the one type of the resuscitations. And the recitations is the procedure, it was helpful for the restoring the life of the patient, like a cardiopulmonary resuscitation, that was known as the CPR, that is nothing but cardiopulmonary resuscitation. Okay, the resuscitations means CPR, that is the cardiopulmonary resuscitation, that is just by pressing the ribs on the chest on the heart side. So that is, it was helpful for to, to restore the cardiac function by enhancing the respiration. Okay, in film or in some areas seeing the doctors, so they are pressing the chest or thoracic cavity by putting the both hand on the locations of the heart where they are pressing. Okay, so they are pressing, so that pressing is helpful for, it can pull the oxygenated blood towards the heart. Then the pulling of blood with the pressure, the heart functions can be restored. So that condition was known as the cardiopulmonary resuscitation, that is the CPR. So like that, the resuscitation is the one condition or process, it was helpful for the restoring of the life of the patients during the emergency. Simply, if any patients having the deficiency or problem in the take the inspirations means, so where someone healthy person they can give the artificial air through a mouth to mouth. Already seen in the many films. Okay, on that condition you should be take the air and hold in the mouth only. Do not inhale. Okay, you take the air and hold in the mouth only, and you can touch the mouth of the patient and give the air from the mouth only. Otherwise some people they're doing, they take the air and inhale it, then after that so they can exhale the air that in the patient mouth. So that was not correct. On that time that patient got the, once again that can got the carbon dioxide, not oxygen. For the process for that resuscitation is, you can hold the air in mouth without inhaled, then immediately you can touch the mouth of the patient and exhale. Okay, then that process was helpful for to remove the congestion in the lungs, then lungs function improvement, automatically the heart functions can improve. So this therapy was helpful for during the angina or during the some cardiac failure or pulmonary embolism, so that can create the fail in the cardiac function. So nowadays in the COVID, so that was the common. So many people so they die. So due to failure of the or pulmonary embolism due to congestions in the lungs. So that's why if you are familiar, so then any emergency cases in our family member only, so then you can do that one, just pressing the chest forcefully about 2 to 4 centimeter only, otherwise the ribs can be break. So that can helpful for restore the improve the lungs function, as well as it can pull the heart, then it can restore the heart functions also. That was known as CPR, or you can go the oral to oral if they are having the deficiency of oxygens. Okay, so last, that is the pneumothorax. That is the some type of the pneumonia or inflammation in the lungs due to accumulations of air. So that was known as the pneumothorax. And hydrothorax, okay, so some inflammations of the lungs due to accumulations of air mean, so that was known as the pneumothorax. And accumulations of water or entry of the water droplets in the lungs, in the especially in the cold season, you always close your mouth, that is the nose, otherwise the water droplets can enter in the lungs through a inhalation air. So that was causes the hydrothorax, that is accumulations of water in the lungs can cause the inflammation. So that condition was known as the hydrothorax. Then due to dysbarisms or change in the atmospheric pressure or any problem, there is a bleeding in the lungs means, that can cause the accumulation of the blood in the lungs, then cause the inflammation. So that condition was known as the hemothorax. Then last one is the pyrothorax, due to any infection, then the pus was accumulated in the lungs mean, so that condition was known as the pyrothorax. So now next, there is the COVID-19. It is also respiratory disorders. That is the, it can causes by the severe acute respiratory syndrome coronavirus. It was also written as denoted as the, there is SARS-CoV-2. Regarding the symptoms, there is fever 88% in patient people. We are seeing the high fever, are in 67% they are suffering from the dry cough, and among the patient 38% they are suffering from the fatigue also. Then phelgum production is 33%, shortness of breath is 19%, muscle pain is 15%, sore throat is 14%, headache is 14%. So these are the COVID-19 symptoms. If you are having the fever means, you can take the precautions. Okay, we can take the more water and become the hydrated. Okay, simply don't worry about when you're having the temperature in you and your family first. Okay, you can take the plenty of water, so that was helpful for restore the temperature. If it is still, it cannot be down, still it can increase, mean immediately you can consult the doctors. In first day only they can give the paracetamol, vitamin C, or any other antibiotics, so then they can correct the symptoms the early stage. Okay, so as a pharmacy or pharmacist, you should be do that once. Okay, so whatever remaining, that will be